just to say, briefly introduce myself, I'm Dr. Malie Coyne. I work as a HSC clinical psychologist in primary care psychology in Galway, in Drohišťa, and I also work as an NUIG lecturer in clinical psychology. And I suppose I'm really all about promoting positive mental health and well-being, and infant mental health would be a particular area of interest of mine. I'm also involved with the Lust for Life, which is obviously a national organisation, and with the Early Years Subcommittee of the Children and Young People Services Committee. Okay, so in terms of, I'm going to be talking about what infant mental health is, because you know, amongst the public, it's not really something that's known very much, but even amongst professionals as well, to an extent. And I'm going to be focusing on substance. Sorry, I'm just going to look at it here. On substance abuse in particular. And when I talk about abuse, I'm talking about misuse as well. So those terms are interchangeable. So apologies if I'm not using the right terms. And then the impact of maternal alcohol misuse on infant mental health, and also how we can support families, and what's happening nationally, what's happening locally. I'm not an expert, I would say, in the kind of alcohol area necessarily in terms of initiatives, but I have kind of done my research to see, I'm kind of more familiar with what's happening in particular locally. So we'll just move on to the next one, the origins of infant mental health. Okay, so infant mental health is a field developed by Freiberg in the 1970s in Michigan. And the whole field is about supporting the social, the emotional, and the cognitive well-being of at-risk babies from conception to age 3 in the context of challenged primary caregiving relationships. It must be seen within the context of the relationship with the caregiver, and that's usually the mother. But I suppose the father, you know, we're talking about mothers in particular today, but you know, there is a significant impact of paternal substance misuse on children as well. And it's not just about mums, but we just happen to be talking about alcohol and pregnancy, and that's why I'm focusing on that particular area. But it's definitely a family kind of issue. And we're looking at it's an early intervention framework of support building on baby and parent strengths. Okay, so what is infant mental health? Basically, it's the developing capacity of the infant or toddler to experience, express, and regulate their emotions, to form close and secure relationships, to explore the environment and to learn. And that's all in the context of family, community, cultural expectations for young kids. So why is it important? Nugent would have said in the Brazelton Institute that a revolution has actually taken place over the last 30, 40 years in our understanding of the capacity of babies and the workings of their brains. Previously, we might have thought because babies are not verbal, or they don't have language, or that they're, cognitively they're not, that able. But actually, there is a critical window of opportunity that takes place in the first 1,000 days of life. 80% of the brain develops during that time. You're talking about the brain pathways beginning to form, and they are shaped by the experiences the baby has. The most pivotal experience a baby can have in terms of their survival is the relationship with the primary caregivers, which are the mother and the father, whoever is in their lives that's very close to them. They need, attachment is all about, you need to attach to your caregiver for survival. It's a biological instinct. And I actually don't think this is in the common domain, that all of this development is happening in the first 3 years. And that's why it is so important to focus on pregnancy and the first 3 years. And I think that's why it's great we're having this conference today. So brain development is radically shaped and structured by experiences and quality of child-parent relationships. Okay, can we move on? Okay, so the attachment is the most important survival task of infancy, as I said, and obviously you've got Bowlby with attachment theory, and there's a lot of reading you can do about that. So it's the dependency relationship that the child forms with their primary caregiver. They need to form that relationship because the parent will provide them with safety and security. The parent is there to tune to and respond to their needs, to provide comfort when they're upset, to share in joyful experiences. This enables the child to feel special and to begin to develop a positive sense of self. It's actually the most important task during the early years, and it actually impacts on all outcomes throughout life, not just mental health. We're also talking about cognitive development, learning, social development. It's absolutely huge. So the children will exhibit behaviours that encourage the caregivers to be present and responsive to their needs. And this occurs during the first 6 months of life, but like the attachment starts to form when you're pregnant, and it goes on until through the first 4 years of life. But just because there's this critical window of opportunity doesn't mean that it's ever too late. Okay, and the factors impacting on attachment would be things like, sorry, I don't have that in my current what I'm watching here, but things like accessibility. So the infant learns the mother is accessible to them when in close proximity, or will consistently return to the child after being apart, which is the origins of trust. And then another factor with attachment is understanding and responsiveness. So it's learned when the mother responds appropriately and consistently to the physiological and emotional needs like hunger and distress. And then attunement would be the emotional connection to the baby and between the baby and the mother. And so that what the mother does is she mirrors the emotional reactions of the baby and is curious about what the baby might be feeling at any particular time. And the mother soothes child when they're distressed. And this kind of begins this trust of the child. Also, reflective capacity is very important here. It's the mother's ability, and I'm talking about mother, but it could be father, it could be primary caregiver, as well. It's the primary caregiver's ability to actually try to understand the world from the baby's eyes. That's reflective capacity. And the reason I'm talking to you about this all now is because alcohol misuse actually impacts on all of those single aspects of attachment. So in this way, it helps the mother to help the child to learn how to emotionally regulate themselves for the rest of their lives and their own arousal. Okay, so we need to value the enormous the enormous energy that goes into creating a new mother. As a mother myself, I can say that and for most parents, it is a time of huge psychological and social change in your life. So it's a time of huge psychological and social change, and I think all mothers in this room can identify with the fact that guilt is just your best friend when you become a mother. You feel guilty about every single thing, about working too long, working not, everything. You just feel guilty about breastfeeding, that's another thing. You're not doing things the right way, mothers are comparing, that kind of thing. So when you think of the fact that substance misuse is the most stigmatizing of all mental health issues, and the reason I'm saying that is, or it's one of the most stigmatizing, is because there's this belief. I read this really great article that there's a belief that substance abuse is due to weak willpower and to low moral strength. So there's an internalization by the mother that in some way she deserves what's coming to her in a way. And when we talk about even things like fetal alcohol syndrome, we just have to be really careful about the language we use and about unshaming. I know that's not even a word, but it's not about shaming. If we talk about what Catherine was saying earlier about behaviour change, nobody's going to change their behaviour if they feel shamed. So it's really important that we need to destigmatize this and support mothers as opposed to shame them. And I'm not suggesting anybody's trying to do that, but there is, that I think that's why not so many women come forward and are open about their alcohol use. So compulsive compulsive use in the face of serious negative consequences for mum and baby is often not a choice. The substance abuse causes changes to the brain over time, triggering cravings and compulsive behaviour. So that's what's making them want to drink more. And the guilt and the shame can be a significant barrier preventing mums from getting support. When you think of they're afraid for TUSLA, child protection services, to become involved in case their kids get taken into care, or they don't want to enter that system. So there is a real, guilt is there anyway for all mothers, but for mothers who misuse alcohol or any other substance, it's there even more because of these consequences. The core issue of substance misuse, when you think about it, is you're talking about something generational. You're talking about pain for a parent, low self-belief, life traumas, isolation. In terms of alcohol use during pregnancy, so let's extend our support and not our judgment, I wrote there. Okay, so it takes a whole village to raise a child. So even though we're talking about mothers today, it's not just the mother who has the only role in the child's life. There are other people involved, and it's great that we're all here in a room together to try to gain awareness of these issues and see how we can actually support families. So despite the public health campaigns about alcohol misuse and the improved knowledge, I think we've spoken about this enough so we can kind of run through it a good bit, is that, a lot of women still drink in Ireland during their pregnancies. I can say myself, I have a 4 and a 6-year-old. I wasn't aware 6 years ago, 4 years ago, that that the message was no alcohol, no risk. That was the definitive message. I'm educated. That's not a message that would have come to me. Certainly, my peers, it would have been like very, very limited, moderate. Very limited, but it wasn't a message that I was familiar with, to be honest with you. I know we're talking about alcohol misuse and too much alcohol, but at the same time, this is a relatively new message, I think, for many of us, and I think it's culturally different as well. In the States, say, it would be like a definite no-no, but I think there are cultural variations, as we've spoken about. So the impact depends, and I'm not going to go into too much detail because we've spoken about the developmental kind of consequences for children, but I want to talk about, I suppose, the relationship with other risk factors like socioeconomic status, mental health comorbidity, domestic violence, polydrug use. You're not very often talking just about substance misuse. You're talking about a lot of different issues that occur in a family that are not just to do with alcohol. You're talking about increased conflict, there could be domestic violence, the mother may have had traumas in her past, other drug use, there's so much actually, and then mental health issues, there's such a relationship at play there. So we can move on. So the reason I suppose I'm talking about infant mental health is that children depend exclusively on their caregivers to look after all of their needs. The review of the literature shows that substance misuse does actually have a significant impact on ability to parent. The literature is not unequivocal, however, there's not every study will say, yes, it definitely impacts on your parenting. Obviously research there will be contradictions, but it certainly has an impact on parenting practices. But there are resilience factors. Very often if there's one parent or one person in that child's life who is very much there for them and who does meet those needs in terms of building the attachment and taking care of them, that can be hugely protective for that child. Okay. So the focus today was on the maternal, as I said, but there's many other, it takes two obviously to, there's lots of other people in the child's life as well. And so women who misuse alcohol want to be good parents. We all want to be good parents. I think we all have a natural instinct as mums to want the best for our babies. But substance misuse can very often impact on all aspects of lives. And it doesn't feel like a choice. The needs and the well-being of other families can become secondary. And also, I suppose, that they might have poor financial and social support, and it can lead to bigger social isolation because women who misuse alcohol will be reluctant to report that to others. So there will be extra social isolation from family and from health professionals. And then obviously alcohol has a significant role in our society. So I think that's what explains these big numbers that you've seen earlier. The quality of caregiving is seriously undermined. It affects parents' judgement and ability to provide care and supervision. They can be socially isolated, hence less access to crucial external supports, less time spent with kids, and often inconsistent, harsh and erratic discipline. Now the studies have kind of found that, that discipline is, giving your child, disciplining them and giving them clear boundaries is part of attachment building and love. I always say to my clients when they come into me, that just giving them giving kids what they want doesn't give them security. You have to, and I say to my own children, I wouldn't say no if I didn't love you. It's so much harder to say no. And when a woman is under the influence of alcohol, or indeed anybody in the family, there is inconsistent caregiving. It can be harsh, it can be erratic. It can increase the conflict in families and co-occur with domestic violence, as I said. The effects of neglect include abandonment, maltreatment, low frustration tolerance, patterns of insecure, disorganized attachments. The erratic histories mean that parent can lack foundation for effective parenting. This is really important when you think of it. If you weren't parented in the optimal kind of way, how do you know how to parent? That's a really difficult thing. If your own attachment with your parent wasn't, as it should have been, then it's really hard. You don't have a template. And then comorbid depression, anxiety, or domestic violence, and a decreased parental sensitivity. Okay, next. Yeah. Okay, so the impact on attachment is that the importance of mothers understanding and responding to their baby's feelings is crucial to their well-being and development. So parenting deficits can lead to decreased emotional responsiveness, availability, acceptance, and sensitivity, which are the exact ingredients that are pivotal in the formation of a secure attachment. So I'm breaking it down, and I'm kind of and especially devastating for infants and young kids whose need for close supervision and continuing care is very great. So those 3 years of life where the baby's brain develops, the 80%, brain pathways and all of that, they cannot rely on anybody but their primary caregivers to survive. So if their primary caregiver is drinking and misusing alcohol, then it is a very, very difficult situation. That it kind of makes sense. Frightening behaviour can be indicative of disorganised attachments. As a primary attachment figure, a mother is child's secure base and haven of safety to which they can retreat during times of distress. This is really important here. When the child's mother is also the source of the distress, the child is faced with a paradoxical dilemma that manifests itself in emotional and behavioural dysregulation. So when you think of it, if your one place of safety is a mother or our father, indeed, I really don't like kind of focusing just on mums, but that's the focus of today. Then it can be really, really a very scary world to live in. And as Dr. Morrow was saying as well, if you've got a child with fetal alcohol syndrome, then obviously there's this interplay between the mother and the baby with special needs, and that's a much more difficult attachment to form. So the presence of a stable adult figure is crucial in increasing children's resilience and mitigating the impact of maternal alcohol abuse. This is just kind of attachment disordered in terms of the kind of negative representations you might have. I am bad, I am unlovable, I am impotent, others are unreliable, unresponsive, uncaring, the world is unsafe. Whereas somebody who has a secure attachment might think, I'm good, deserving, capable, understanding, responsive, accessible, others are understanding, others are responsive, and the world is safe. Now, it's not as easy as black and white as that, and I'm not for a minute suggesting that women who misuse alcohol during pregnancy will always form difficult attachments with their babies. I'm not suggesting that, but I'm just saying it increases the challenge. Okay, so just in terms of what's happening locally, and so how can we support families? So it's a crucial opportunity to affect change in child's life, the early years, due to brain plasticity and ability to work on child-parent attachment. Family initiatives are most effective with younger kids. By the time kids reach an older age, it's a less effective intervention. And it's important to build on the resilience factors. If there is a strong caregiver in the home, then build on that, you know. The problem is cross-cutting requires inputs from many services and disciplines, and it's important to increase this interagency linkages like what we're doing today between addiction services, TUSLA, HSE, childcare, domestic violence, all the services. And then there is a role for adult treatment services in flagging parenting issues and child services in flagging addiction, mental health issues. I don't think this is happening as it, you know, I think we need to really work on this. Because I think there isn't, particularly Galway, I mean I can only talk for Galway, but there isn't enough of a link between the services. And we all have a communal responsibility to protect kids according to Children's First. And there's educational efforts obviously necessary to educate Irish women on the adverse effects of alcohol on fetal outcome. And this campaign 0 for 9, because alcohol and pregnancy don't mix. In terms of, so nationally and locally, we've got the Galway City Early Years Health and Wellbeing Plan, which was developed by the Children and Young People Services Committee, of which I'm a member. We've got a hospital perinatal mental health group in the hospital. We've got a Children and Young People Services Committee parental mental health subgroup as well. The Irish Association of Infant Mental Health is an association I'm part of, and you can become a member and find out more about their events. And the Psychological Society have an interest group in perinatal mental health. You've got the HSE Nurture Programme and obviously the National Maternity Strategy that looked at alcohol. So I won't go into that really in detail, but just there's only 1 or 2 pages in the maternity strategy on alcohol and on mental health issues, which I think is a little bit worrying given the fact that it's that big. We all made submissions to it, but I think we have a long way to go in terms of how critical mental health is, and substance misuse and all of this awareness is in terms of health. We seem to focus more on physical health, which is important, but and on services. So the Children and Young People Services Committee, the Galway City Early Years Plan. So one of the things that we would have, so it's about providing, there would have been a focus on tobacco, alcohol and drugs, and I just put a tick there because what we're doing today and what, the initiatives that are happening with health promotion and the Western Regional Drugs Task Force, and a lot of these, objectives are being covered. In terms of infant mental health, which is my area of interest in particular, is that moving on? Okay, so it's about delivering training on current best practice and evidence of infant mental health. That's what we're doing here today, and we've done it a number of times. Public awareness days, developing a perinatal care pathway that was done in the hospital. There needs to be one in the community. Putting posters up around facilities to increase this awareness of infant mental health, and reflective antenatal classes. We've been talking about that, and in fact a baby bonding training is occurring here in the next few weeks and will be funded by ourselves for professionals and parents actually to attend as well, to run it with new mums. So the foundations for virtually every aspect of human development, physical, intellectual, emotional, are laid in early childhood. The earliest experience set life course in motion and determines lifelong health. Babies can't seek help for themselves, they need attuned caregivers. So early intervention has better long-term outcomes, and childhood emotional well-being is the strongest predictor of a successful and satisfying life in adulthood. And that's, I guess I'm just so passionate about it, I kind of think it's just, it's a no-brainer. We have to focus on the early years. Okay, and I'm nearly finished, but just look at this graph. So the amount of spending, I know you can't see it very much, but the amount of spending on programs to change the brain increases as the lifespan increases, right? But the brain's capacity to change goes down, okay? So like we need to do something in terms of reversing that. And then society can't wait. The costs are just too much if we don't actually focus on the early years. Paul Dalton would have said infant mental health is everyone's business. And children are our most precious resource. They are the living messages to time we will not see. And just so, like, we need to break the generational cycle, and I suppose to not, for me, the most important message from today is it's not about shaming, it's about supporting. And just my presentation has quite a number of support services that are available. You can kind of go through that. Within Ireland, and also I also have resources that I would have used for this presentation, and good resources that I actually found. So that presentation will be available to you online, and contact me anytime. And those are my little girls working together to give every child the best head start. So I suppose the reason I do it is I don't know, I suppose because it's such an important thing to do for our younger generation, because they can't do it for themselves, so we need to empower them. Thank you.